from the station you count on for local news that matters. This is KARK4 News at 5 in high definition.
When a stroke happens, time is everything. From the second you notice symptoms to the minute you end up at the hospital. Because health matters, KARK's Suzanne Bruner shows us two big treatments doctors use to help a Little Rock man make a full recovery, and also what's preventing doctors from performing the life-saving procedure.
I was lucky.
It's hard not to get emotional if you knew all Jim Swenson has been through. He's back at Baptist Health with his wife, who never left his side.
The key was Joan recognizing it right away.
At home in January, Joan called out to Jim, who was on the computer. He didn't respond, even after the second time.
I got up, evidently, and my right side failed me, and I just barely missed hitting my head.
Jim fell to the ground. It was immediately clear to Joan he was having a stroke and called 911.
All the stars fell in place.
They said the response was fast, and so was the treatment. The next thing Jim remembered was waking up in the ICU. He couldn't talk.
This is from the CTA that we did.
An MRI shows what happened to Jim's brain. The left is an image of a blood clot. On the right, Dr. Whit Goodwin points out what happened to Jim's brain after a thrombectomy to remove the clot.
Big problem is it's actually fairly rare that people are able to make it to the hospital in time to have this.
What made Jim's recovery tremendous was he got to the hospital early enough to get the TPA drug. TPA helps reverse the effects of a stroke. He received that before undergoing a thrombectomy.
Once they get the TPA, like I said, we go ahead and start activating this process in case they don't get better.
It took Jim 3 days to see results.
I was so lucky. I was so fortunate. I didn't have to learn anything. It just all came back.
In Little Rock, I'm Suzanne Bruner.
And that's why it is a good reminder to identify stroke, the acronym. It's FAST. That's what they do. F stands for facial drooping, also A for arm weakness, S for speech difficulty, and T for time. Again, it is FAST. Just remember that.